I think it's vital for municipalities like the Woodland Park to partner with the Passaic County Health Services. They have a broader outreach for resources, they have a larger staff, the things that they can bring to our town, the programs, the health facilities, the mobile units is something that we would not have access to if we were on our own.
Going back during COVID, the response from the county was huge. The information that they gave us, the data that they sent out all the time, pretty much on a daily basis. How they handled the setting up of the vaccines was, we were pretty much impressed with that because our residents were taken care of. They made it pretty simple when they opened up the vaccines, at the Passaic County College, that's down on Union Ave. They made it easy for our first responders to get vaccinated. But the data they kept us informed of with the COVID that was going on was really important to us because then we can get the information right out to our residents. So that was their response to that made us feel that they're going to respond with our Board of Health, bringing them on board was really important to us because their responses were pretty quick. And it was just a great partnership then, and we want to continue that now.
Anytime you can have a shared service agreement with another municipality or the county, it works for everyone. Not only does it provide better services, but it cuts down on the budgetary costs. Being able to share salaries, being able to share insurance, being able to share resources, it definitely helps when we do our budget. It increases services, but it also decreases the individual costs that each municipality may have.
Efficiencies. Well, when we worked out the shared service, of course, shared services, everybody's supposed to benefit from it, whether it be the county and our municipality. But for Bloomingdale, we looked over the cost savings over the terms of the contract. It'll be over $300,000 savings to the residents of our town. And we believe with that savings, we're not only getting the savings, but we're getting a better response from the county and more programs through the county. So it just worked out on all ends. We're in a short period of time. January is when we first came into the share service starting, so it's really a short window of where we're at. But the transitioning that the county worked out with our previous health provider was just like seamless. So that is an example of how the county is going to handle things for our borough. So they're very efficient, responses are great, but overall the transition between the county and our previous provider was really seamless. So that was pretty impressive.
While our partnership with the county has been ongoing for years, it was never more evident how much we needed them as when COVID struck. It was a polarizing time. People were scared. It was a very, very hard time to get through. And having Dr. Gumhill and her staff was amazing. I have no doubt that the resources they brought to Woodland Park, opening up the first inoculation site in Woodland Park, it definitely saved lives here in Woodland Park. Having access to those life-saving drugs and resources and information, that is something that I will always know had the greatest impact in Woodland Park, and we would not have had that without this shared service agreement. Having everything under one roof with Passaic County has not only saved us time and money, but it also adds to the value of our businesses. We have inspectors now that really care about what's going on in Woodland Park. Not only do they care about the safety of our residents, but they're not here to make things difficult for our businesses, but they are strict. They make sure that things are safe. And that's something that we can never skimp on. That's something that we absolutely need to make sure continues in the future, is that our residents are protected, our businesses are supported, and if we can save some money in a time like this now, that's fine.